Hello, everyone. Thank you so much for joining us today for this conversation about the future of healthcare in a free Iran. I wanted to start by thanking everyone at Nufti, the volunteers, panelists, and authors for their tireless work in developing this framework for us to hit the ground running and clean up the regime's mess after their inevitable collapse. I've worked in healthcare in the United States for several years now. Healthcare is not just a policy issue, it is a human right. It is a reflection of how we as a nation value the dignity and well-being of our people. And in a future Iran, one built on freedom, justice, and opportunity, we must ensure that every Iranian, regardless of income or background, has access to high-quality, affordable, and compassionate care. Today, however, Iran's healthcare system is mired in both a fiscal and a moral crisis. Ordinary families are being crushed under the weight of rising costs, while the regime continues to abandon even its most basic responsibilities. Iranians are paying more and receiving less, trapped in a system shaped not by compassion or competence, but by mismanagement, neglect, and corruption. Out-of-pocket payments already make up nearly 40% of total healthcare expenditures, one of the highest rates in the region, and this burden is expected to grow. That means millions of Iranians are one diagnosis away from financial ruin. Meanwhile, shortages of more than 100 essential medications, including life-saving treatments for cancer and rare diseases, have become tragically routine. The regime has failed to secure even the most straightforward pharmaceutical supply chains. As a result, counterfeit drugs are flooding the market, endangering countless lives and forcing patients to gamble with their health simply to survive. Parents are forced to make impossible choices between buying their child's medication or putting food on the table. Cancer patients are skipping chemotherapy because the drug is out of stock, or worse, because they can't afford it. Grandparents are rationing heart medication, taking half doses to make a prescription last the month. In today's Iran, illness can mean bankruptcy. The regime has, of course, left ordinary Iranians to face this crisis alone. This is not just a budgetary failure. It is a betrayal. It's not the result of sanctions. It's the result of the Islamic Republic prioritizing its ideology and its wars over Iran's people. That's why I'm glad that in its very first group, the Iran Prosperity Project has addressed this crisis. The IPP Economic and Social Stabilization Group offers an informed, academic, fact-based vision for rebuilding Iran's healthcare system. It confronts the consequences of decades of inequality, mismanagement, and neglect under the Islamic Republic. It addresses the complex demographic and economic challenges Iran faces, including an aging population and a strained public budget, and proposes reforms rooted in bold innovation and globally tested models. As we prepare for a free and democratic Iran, we must remember the vision my father has shared for decades, that freedom is not abstract. It is the ability to raise a child without fear of preventable illness. It is the peace of mind that your health will not bankrupt your family. It is the conviction that the state exists to serve and protect the people and not the other way around. To bring about this new paradigm requires political change in Iran. But to make that change sustainable requires economic plans like the one set forward today by IPP. Let us never forget, healthcare is deeply personal. Behind every statistic are real people, mothers, fathers, children, who deserve to live with dignity and without fear of financial ruin due to illness. Fixing Iran's healthcare system is not just a policy challenge, it is a national imperative. If we get this right, it will send a powerful message that the new Iran values life, fairness, and the well-being of every citizen. Thank you again to our author and our panelists for your vision and expertise, and to all of you for being part of this vital conversation here today. Sorry I was late.